Hi everyone, I'm Anu Kathiresan, fertility physician and Dr. Mom, and here to educate on fertility. In this video, we'll be talking about when to see a fertility specialist. So let's get started. What is the difference between an OBGYN and an REI? First, REI stands for Reproductive Endocrinology and Infertility Specialist. You'll often also hear them called a fertility specialist, but essentially they're interchangeable. The difference in our training is initially we start off with the same training as the OBGYN. We do 4 years of medical school after completing our undergrad, and then an additional 4 years of OBGYN residency. At that point, the OBGYN has completed their training and they can go on to practice. The REI has an additional 3 years of fellowship training to complete before they can go out into practice. So that's essentially the difference between the OBGYN and the REI. If a woman is young and there's no known infertility factor, it's reasonable to start with seeing your OBGYN if you need assistance with trying to conceive. It's also good to see the OBGYN, generally speaking, for preconception counseling. They'll go over your medical history, if there's any genetic conditions that run in the family, make sure all the vaccines that you need are on board, and that you're on a prenatal vitamin at least 1 month before trying. If there are any medical conditions, they'll also help with making sure everything's well controlled. So it's always a good idea to start with preconception counseling with your OBGYN. There are some circumstances where it's good to also see the fertility specialist, so I'm going to go over those now. Circumstances where it's reasonable to see the fertility specialist right away are if cycles are irregular. So what does that mean? Regular cycles come every 21 to 35 days. If they're falling in that interval, this is considered normal. If they're falling outside this interval, then these are considered irregular cycles, and we're concerned that ovulation may not be predictably occurring, and so it's reasonable to come see us for assistance. The other circumstances where it's reasonable to see us right away are if there is a known infertility factor, for example, a known male factor, a known uterine factor, a known tubal factor, endometriosis. If there's anything known, then it's okay to go ahead and come see us. Now, if cycles are regular and there's no known infertility factors, then when it's recommended to see us is if you're under the age of 35, and again, cycles are regular. If you've been unsuccessful 1 year, it's recommended to see us. If you're between the ages of 35 and 39 and you've been unsuccessful for 6 months, it's recommended to see us. And if you're over the age of 40, it's actually recommended to see us right away. The reason is that with advancing female age, there's a decline in ovarian reserve. And with that decline, there's also a decline in success rates with fertility treatments. So we just don't want time to be wasted, and we want to help you when it's reasonable to do so. Other circumstances where it's also recommended to see an REI is if there's a history of recurrent pregnancy loss, if patients are wanting to preserve their fertility, to freeze their eggs. These are all circumstances where it's also recommended to see us. This is a common question that I get on social media, so I hope this video helped to answer that question. That is it for this video. I hope you found it helpful. If you did, I hope you'll give the video a like. Don't forget to subscribe down below. If you have comments or questions, you can leave them for me there also. Thank you again so much for watching, and see you in the next video.